So first one, we have metronidazole. So your metronidazole is effective in three diseases. We have giardiasis, trichomoniasis, and amoebiasis. So meron siyang triad features kasi siya ay pwedeng gamitin for GTA or giardiasis, trichomoniasis, and amoebiasis. So meron siyang anti-amoebic, anti-giardiasis, and anti-trichomonal properties. Next, we have emmetine and dihydroemmetine. So this one, your emmetine and dihydroemmetine, it is considered as a protoplasmic poison. So it exerts a direct amoebicidal action on various forms of Entamoeba histolytica. So this will inhibit, since siya ay protoplasmic poison, this will inhibit protein synthesis in protozoa and mammalian cells by preventing protein elongation. Next, we have pentamidine isethionates. This one is used as an alternative drug for pneumocystis carinii. Kasi nga, ang drug of choice for pneumocystis carinii is your cotrimoxazole, brand name Bactrim. Okay, next, we have Nifortimox. Nifortimox is used to treat Chagas disease caused by Trypanosoma cruzi, which is also known as your South American trypanosomiasis. The vector for this disease is your redovid or your kissing bugs. No? Para madaling tandaan, remember, di ba, si Tom Cruise ay isang South American na mahilig or magaling humalik, kissing bugs. Next, we have benzimidazole. The activity of benzimidazole is same with your Nifortimox. Hence, this is an alternative drug for Chagas disease caused by Trypanosoma cruzi or South American trypanosomiasis. Vector, kissing, or redovid bugs. Next, we have millarsoprol. Millarsoprol is used as a treatment for the latter stages of both forms of African trypanosomiasis. Diba, in African trypanosomiasis, meron siyang dalawang forms. We have your Trypanosoma brucei, gambiense, and Trypanosoma brucei, rhodiense. Si gambiense, siya yung West African um, sleeping sickness, and yung rhodiense, siya naman yung East African sleeping sickness. The vector for African trypanosomiasis is your tsetse fly. Next, we have sodium stevogluconate. Your sodium stevogluconate is used to treat various forms of leishmaniasis. Next, we have your dimercaprol. Dimercaprol is also known as your BAL or British anti-Lewisite or dithioglycerol or 2,3-dimercapto-1-propanol. This is also used as an antidote for heavy metals such as your arsenic, your antimony, mercury, and your lead. Next, we have suramine. Suramine, the structure of your suramine contains now 2 urea derivative and 6 sulfonic acid groups as their sodium salt. So ito po yun. 1, 2 urea, and then 6 sulfonic. 1, 2, 3, 4, 5, 6. Suramine sodium. Next, we have your anthelmintics. First, we have your piperazine. Your piperazine, the mechanism of piperazine, this will block your acetylcholine, causing now flaccid paralysis. So flaccid paralysis of helminths due to blocking of acetylcholine response. Next, we have your diethyl carbamazepine citrate. This is used to treat various forms of filariasis, including now your Bancroft, onchocerciasis, cyasis, and laviasis. Next, we have your parental pamoate. The mechanism of action of our parental pamoate. Um, this will depolarize neuromuscular. It is considered as depolarizing neuromuscular agents, no? Because this will inhibit your nicotinic receptors, causing now spastic paralysis in susceptible helminths. Next, we have your thiabendazole. So your thiabendazole exhibit a high affinity for your tubulin, the precursor protein for microtubule synthesis. Your thiabendazole is a drug of choice for your letter T threadworm infection or your strongyloides. So letter T, thiabendazole, threadworm. Before mag-letter T, letter S, strongyloides. Okay, next we have your mebendazole. Your mebendazole also exhibits your or inhibits microtubule synthesis, which will deplete glucose of the helminths but not the glucose of the host. That is your mebendazole. Next, we have albendazole. So albendazole is used as it is effective as a single dose treatment for ascariasis, new and old world hookworm infections, in trichoriasis. So letter A, albendazole, ascariasis, letter A din. Next, we have niclosamide. Niclosamide is used for cestodes like Taenia saginata. No? So therefore, it is a potent taeniacide that causes rapid disintegration of worm segments and the scolex. Okay, next we have praziquantel. Your praziquantel increases membrane permeability to calcium, which can cause massive contractions, leading to paralysis, then phagocytosis, tapos mamamatay na po ang ating worm. So, increases membrane permeability to calcium, which causes massive contractions, then paralysis, tapos phagocytosis hanggang sa mamatay ang ating worm. That is your praziquantel. Next, we have ivermectin. Your ivermectin targets now your GABA receptor. Pag na-target niyo yung GABA receptor, this can cause paralysis sa ating worm. Your ivermectin is a very useful anthelmintic drug for Onchocerca volvulus. This Onchocerca volvulus can cause your river blindness. So we're done with anthelmintics. Let's proceed with antibacterial sulfonamides. First, we have your proton seal. Your proton seal is a bright red dye. And this drug, once na metabolize siya in vivo, siya ay magiging sulfonamide. The active metabolite of your protein seal, which is a bright red dye discovered or studied by Gerard Doma, is your sulfanilamide. The mechanism of action of sulfanilamide, your uh, mm, your sulfonamide or sulfanilamide competes with PABA for dihydroteroid synthetase, which prevents synthesis of folic acid. So ito po yun. This is your sulfonamides interact or compete with your PABA in order to prevent your dihydroteroid synthetase na metabolize ito, mapiprevent ito. No? Your sulfonamides will inhibit this enzyme para walang ma-form na folic acid. Some adverse effects of our sulfonamide. First one, we have your crystalluria. So meron tayong formation of crystals in our kidney. Pag na-form ng crystals, mahihirapan pong umihi, which is very toxic or which is toxic to our kidney. Now, in order to prevent the formation of crystals in our urine, you need to take an adequate amount of water. You need to hydrate yourself. And you also need to alkalinize your urine. Therefore, pag na-alkalinize your urine, this will reduce the concentration of drug and promotes its ionization. So, mas mabilis siya mamalabas pag na-alkalinize ang ating urine. Yan po yung crystals produced by our sulfonamides. Okay, next, adverse effect of sulfonamide is hypersensitivity reactions. No? Almost lahat naman ng antibiotics merong hypersensitivity reaction na adverse effect. No? So examples of hypersensitivity reactions, we have your rashes, angioedema, Stevens-Johnson syndrome, which are fairly common. Yan. Next adverse effect, we have hemolytic anemia. This is encountered in patients with glucose 6-phosphate dehydrogenase deficiency, yung mga patient na may G6PD. Aside from hemolytic anemia, granulocytopenia and thrombocytopenia can also occur. Granulocytopenia and thrombocytopenia. Next, we have kernicterus. So itong kernicterus, nangyayari siya common sa mga baby. Kasi yung blood-brain barrier ng baby ay hindi pa masyadong fully developed. No? So nakakapag-pass through dun sa blood-brain barrier ng baby yung ating bilirubin. Your bilirubin is an orange-yellow pigment that occurs normally when part of your red blood cells break down. And high levels of it can cause a yellowing of your skin and also your eyes. Due to the danger of sulfonamides, or due to the danger of kernicterus, sulfa drugs should be avoided in newborns and infants less than 2 months of age, as well as in pregnant women at term. Next, sulfonamide should not be given to patients receiving methenamine because your sulfonamides condense with formaldehyde. So, yan po yung kernicterus. So, nagpapass through po siya sa blood-brain barrier ng baby kasi nga hindi pa fully developed yung blood-brain barrier niya, causing now kernicterus or yellowing of the eyes and also the skin. Some effects of our sulfonamide. Your sulfonamide can cause drug-drug interactions with other drugs such as tolbutamide and your warfarin. Tolbutamide plus sulfonamides. Your sulfonamides will enhance the activity of your tolbutamides by inhibition from your protein binding sites. Pag yung warfarin plus sulfonamides naman, this will enhance the effects of our warfarin. Di ba ang warfarin ang ginagamit is blood thinning agent siya. Blood thinner. So, pag enhance na yung activity ng warfarin, therefore, prone ngayon yung pasyente sa bleeding. Next, we have sulfasalazole. This is not used for topical application on external surfaces. Next, we have sulfadoxime and pyrimethamine. This is a mixed sulfonamide used for the treatment of Plasmodium falciparum malaria in patients in whom chloroquine resistance is suspected. Pwede rin siyang prophylaxis for malaria. Next, we have our topical sulfonamides. We have your sulfacetamide, sulfoxazole dioamine, then triple-sulfa. Your sulfacetamide is used for ophthalmic infection susceptible to sulfonamide therapy. Your triple-sulfa composed of sulfabenzamide, sulfacetamide, and sulfathiazole. Sulfabenzamide, sulfacetamide, and sulfathiazole, brand name FemGuard. So itong triple sulfa ay ginagamit as a vaginal cream in the treatment of Haemophilus vaginalis or your vaginitis. Triple sulfa, sulfabenzamide, sulfacetamide, and sulfathiazole. Next, we have your mafenide acetate. Ito na ginagamit siya sa burn. No? Burn therapy po ang mafenide acetate. This is a non-absorbable sulfonamide. Your silver sulfadiazine, brand name Silvadine or Flamazine, 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 Flamazine. Ginagamit din siya for burn therapy. Next, we have your sulfasalazine. Ito ginagamit for intestinal infections, ulcerative colitis, or reduction of bowel flora. Next, we have our dihydrofolate reductase inhibitors. Kanina, itong sulfonamide, this will inhibit your dihydroteroate synthetase to prevent the formation of folic acid. While your trimetoprim will inhibit now your dihydrofolate reductase para walang mapuform na tetrahydrofolic acid or your folic acid. No? Usually, in combination yan. No? Combination ang sulfonamide tapos trimetoprim. One preparation na mayroong sulfonamide and trimetoprim is your sulfamethoxazole and trimetoprim, or also known as your cotrimoxazole, brand name Bactrim. Next, we have our sulfone. Isa lang yan, we have your dapsone. Dapsone ay ginagamit for the treatment of Hansen's disease or leprosy caused by Mycobacterium leprae. Remember that our Mycobacterium or our Hansen's disease or leprosy, meron siyang dalawang types. We have lepromatous and tuberculoid. Yung tuberculoid, ito yung localized form of leprosy. Walang destruction of nerves leading to loss of sensation. As compared to yung lepromatous, ito yung may destruction of whole body parts. Hence, kung meron tayong destruction of whole body parts, yung drugs na pwedeng gamitin for lepromatous type of leprosy, yung tatlo, dapsone, rifampin, and your clofazimine. Pero sa tuberculoid leprosy, dalawa lang, dapsone and rifampin. And